to health and social care workers because of the chance that this is going to reduce the probability they will infect others. So there's a very good logic, but they've not gone all the way of recommending universal boosters for everybody. So they've taken a middle path, which some nations have gone for. But the logic of the boosters for the UK I think is clear and science-based, and the ethical imperative, as well as the overall need to do that, I think is widely agreed. And those two, I think, are separate discussions. If we suddenly stopped having boosters, given the particular vaccines we're using, which are the mRNA ones with very ultra cold chains, actually at the moment not very long shelf lives, the idea that's somehow going to transform the situation in lower income countries, I think, is a misunderstanding. I think those are separate issues, but both are important.
Yeah, just to build on that, and I agree completely with what Chris has said. If you think about the degree of immunity we've got and the levels of behavioural restriction that people have imposed upon themselves, so people aren't meeting as many people, we know contact patterns are still quite a long way down compared to where they were, but they are changing quite fast. The faster they change, the more pressure this is going to come under, and that may well lead to a significant increase. If you look at, go just across the channel, countries where you've got similar levels of immunity and some higher degrees of restriction, what you can see is that the cases are going down. So you can see we're sort of at that pivot point where things are flattish at the moment. If they go up quickly, then as I've said, you've got to go early in terms of getting on top of it. You can't wait till it's late because you have to do more. So that's sort of where we are on that. And on the boosters, the waning of immunity is clear. It's greater for infection than it is for the waning against hospitalizations and deaths. So they're holding up very well. And I want to just say the really important point is these vaccines are really good. They are really effective vaccines, far more effective than we could dare to have hoped for at the beginning. So this is some waning. And that waning is most evident in the people who are most at risk. And so getting on and getting that topped up does two things. It gives a very high level of antibody coverage, and it probably broadens the coverage across variants as well, because you've got such high response. So I think it's a sensible thing to do. JCVI have considered it very carefully, and I think their recommendation is a very sensible one.
Great, thanks. Gary Gibbon, Channel 4.
Thank you very much. Professor Whitty, you talked a bit about the metrics for how we might decide we've got to move from plan A to plan B, lockdown light, maybe. What about the trigger? Is it most likely, do you think, that it'll be a new variant that would actually change the game here? Is that the real game changer that you'd be expecting to transform the horizon there? And when the Prime Minister said he would urge people to consider wearing a face mask in crowded indoor places, you say we're in a very serious condition. Is considering it enough? And Prime Minister, on vaccine passports, you said in this building in July you served notice that you're planning to bring them in. Were you really planning to bring them in? Were you just trying to get the numbers up of younger vaccination? We've then had lots of other mixed messaging, which isn't great in public health. What's going on?
Chris, you want to go first on that?
Thank you. In terms of new variants, certainly new variants are one of the things we need to look seriously at. Now, of course, variants are happening the whole time, have always happened. What we need, the worry would be one that can escape from the vaccination. So the Delta variant is a very bad variant. I mean, let's be very clear, it's a very bad variant, and that's the reason we've had such trouble in the last year, as every country around the world. We have not faced a winter with the Delta variant. So it is possible that the combination of winter events plus the Delta variant, which is highly transmissible, could lead to a situation where, on the basis of the data, ministers decided that they wanted to trigger all or some of the Plan B, as the Prime Minister's laid out. So I think we have to take it as it comes. I think anybody who can say with confidence they know how this is going to work over the next few months has not fully understood, I think, the range of possible ways this could happen. But certainly were there to be a variant that was both transmissible and escaped from the vaccines, that would put us in a new situation, and no doubt the Prime Minister would come back and explain where he wished to go at that point in time. But we're not at that point in time. I think at the moment our expectation is the Delta variant, but over autumn and winter, is what we face at the moment. And then in terms of masks, I think my previous suggestion to people remains my view, which is if you are in a crowded environment, particularly if you're in an indoor space, wearing a mask is a way of helping protect other people. Being vaccinated really helps protect them, but it's not a complete protection. People can get infected and they can transmit vaccinated. There's much lower probability to both of those. Wearing a mask helps to reduce that. It's not something you need to concern yourself so much if you're outdoors in highly ventilated areas. And the other area where I think it is sensible is if actually you've got people around you who wish you to do so, either because they've got medical conditions or simply because that is their desire. I consider it an issue of common courtesy. There are a number of situations you would want to wear a mask, but that's not universal, and it's a recommendation. It's not something which the government has put into regulation.
Excellent, thank you. And look, just Gary, on your point about COVID certification and vaccine passports, as it were, I really do defend these in principle. I think it was right to set out in July that we could go forward with those measures. And actually, what has happened is, I mean, if you think about a year ago, where we were, last September, can you imagine if we'd had then COVID certification, we would have been able, with that tool, to keep open businesses that had been forced to close and were going through an absolutely wretched time. They would have been a total game changer, a lifesaver last year. And so I think that they're important they're an important part of our repertoire. And it's great that loads of events have been working to use them. People have been making the system work. And as I said earlier on, we may because of where the disease gets to, we may have to use them in a more thoroughgoing way. We reserve the right to come back to you and say we think that that's going to be necessary. And I do think the public understand that. They can see how it could work. There are plenty of other countries that are doing it right now. But at present, we don't think it's necessary to proceed on that basis. We think that we can keep going with all the stipulations that I mentioned and Chris reinforced that we're asking people to observe. We think that's the right balance given where the data is now. But you've got to be mindful that this disease does have a way of changing and moving. What is absolutely for certain is the vaccines made a vast difference. And if what I hope people take away from this press conference, above all, is not perhaps the importance of Plan A or Plan B, but that fixing that gap in the number of people who have had their vaccine of whatever age, and that statistic about the risks to an unvaccinated person in their 30s seems to be very, very powerful. And I would just, the numbers are going up, and it's very encouraging to see how many people are coming forward to get vaccinations. And I would just urge everybody who is still a bit apathetic about it to join the club, because it's worthwhile. Steve Swinford, The Times.
Professor Whitty, one of the world's biggest female celebrities, Nicki Minaj, has today publicly linked the coronavirus vaccines to impotence. Now, she's got 8 million followers on Twitter. Many of them are young people, the young people you're suggesting should get vaccinated. What would you say to them, and how concerned are you by public comments like that from public figures? Prime Minister, SAGE and SPI-M have both advised that the government, that working from home is one of the single most effective measures at reducing transmission. But looking at your autumn and winter plan, it's not actually part of Plan B. It seems to kind of hover as some kind of Plan C with a decision on its shelf for a later date when we actually look at the document. Why are you more reticent about deploying working from home to combat this? And one last question. Prime Minister, a lot of your cabinet are feeling very anxious as we're gathered here today about their own futures. Can you formally rule out a reshuffle ahead of the Conservative Party conference?
Chris, on the reshuffle.
Thank you, Prime Minister. So there are a number of myths that fly around with varying, some of which are just clearly ridiculous and some of which are clearly designed just to scare. That happens to be one of them. That is untrue. My own strong suggestion, if I may, to media present and not present, is repeating them in public actually just gives them credence, which they don't need. They're untrue, full stop. If you think about where we are actually overall, and this is a slightly longer answer to your question because I think it's a very important one, the great majority of people are getting vaccinated. So the great majority of people are ignoring these myths. And if you talk about people in their 50s and 60s and 70s, you're talking about over 90% of people getting vaccinated, and very few people actually are actively, in a sense, in the anti-vax group. There are a group of people who've got strange beliefs, and fine, and they make their own choices, and in a sense, also fine. Adults are allowed to make their own choices, however strange. That is a basic principle of medical ethics, actually. But there are also people who go around trying to discourage other people from taking a vaccine which could be life-saving or prevent them from having life-changing injuries to themselves. And many of those people, I regret to say, I think know that they are peddling untruths, but they still do it. In my view, they should be ashamed. And I'll leave it at that.
And I'm just on that, Steve. I'm not familiar with the works of, or not as familiar with the works of Nicki Minaj as I probably should be, but I am familiar with Nikki Kanani, superstar GP of Bexley, who's appeared many times on before you, who will tell you that vaccines are wonderful and everybody should get them. So I prefer to listen to Nikki Kanani. And on your point about working from home, this is one of those things where I think just look at what the public are doing. I think people are coming back to their offices. That you're seeing the numbers that I'm reading suggest that people are more confident. They're getting back into their places of work for the reasons I've given many times before. I think that that's a good thing. I think that on the whole, particularly for younger people, you need the social capital you get from the workplace. You need the learning from colleagues. I think that will, on the whole, be more productive and it's fairer to everybody if we can do that. But people are also being sensible and responsible. If we have to change the guidance that we give on that, then we will. But that's Plan B. As you've heard earlier on.
Can I just add to that premise? I mean,
yes.
The point about something like working from home, it's about contact patterns. And in a way, this is all quite straightforward, that the disease spreads much more rapidly the more contacts we have, and in certain environments, the more contacts you have are more risky. And working from home is just a way in which contacts inevitably go down. So that's why it was highlighted as a particularly effective measure to decrease spread at times when you have big increases in levels.
Thanks. Lizzie Buck in the Mirror.
Thank you, Prime Minister. You've spoken about reserving the right to use vaccine passports, and the Plan B document states that they could be imposed for nightclubs and large venues, but it doesn't entirely rule them out, mandating them more widely. Are you considering imposing them in pubs, or would you like to rule that out? And to the scientists, what are your views on the evidence behind the use of vaccine passports? PHE found that they mitigate the risk of transmission, so why are we not using them now?
Thanks very, very much. But no, Lizzie, I've never been in favour of vaccine passports for pubs. I've been, I think, pretty clear about that throughout the pandemic. But I do think that there are settings, as we put it, nightclubs, large music venues, and so on, or venues with big, closely packed crowds, where they might be appropriate. As we all know, some events have been using them over the summer very effectively to get going, and I think it would be sensible for a government not to rule that out.
In terms of the question to us, I mean, the question about whether it's a passport is entirely one for political leaders. That's a legislative and societal one. From the science point of view, though, I think nobody would doubt that you're safer off if you go to any indoor venue where everyone around you is vaccinated. It reduces the probability they will get COVID at all. It reduces the probability if they do have COVID, they will pass it on. And if everybody in the environment is vaccinated, the chance of a mass spreading event is very substantially reduced because everybody's got it. So things that are to encourage everybody to get vaccinated, particularly if they're going to large mass events indoors, the evidence that is going to be a good idea is rock solid. How that's done is very much a matter for ministers.
Good, thank you. Adam Payne, Politics Home.
Thanks, Prime Minister. A question for you, please, on the potential mandating of vaccine passports. Michael Kill, who's the CEO of the Nighttime Industries Association, told Politics Home today that the government's handling of this issue has been chaotic and that Plan B could force nightclubs and venues to make massive logistical changes at a moment's notice. What's your message to Michael and that industry and to Professor Whitty and Sir Patrick, please? Do you have any data on the effectiveness of the booster shot? Professor Ferguson yesterday said a study in Israel suggested people were 10 times less likely to catch mild disease after receiving a third dose. Do either of you have any information you can share on that, please?
Yes, thanks very much, Adam. On nightclubs and the whole nighttime economy, we want to keep it open. And the big difference between this year and last year is that thanks to vaccination, we are able to keep it open. It's a great thing. We just have to be sensible and look at the risks that we face. And I think that some sort of COVID certification system of a kind that plenty of venues have been using already might well be sensible. We're working with the industry, including the nightclub industry, to make sure that they understand what could be required of them. And of course, I understand the frustrations of people who are wondering whether or not they're going to have to put this in. At the moment, we're confident that you won't, that we'll be able to proceed without it. But the choice is, and the reason for wanting to have this option is because it's a choice that then between proceeding with COVID certification or sadly once again asking places to close. And I certainly don't want to do that. So that's why I think it's a good idea to keep this up our sleeve and keep this in reserve.
And on boosters, I mean, it's very clear that the booster shots cause a very big increase in antibody responses, and that would be expected to have a very big knock-on effect for protection in terms of infection and hospitalisations and death. So I think the data look pretty clear on that.
One just final point, which is on the first one. I think a lot of people believe young people aren't taking up the vaccine. Not true. The great majority of people 16 to 29 have already taken up their first vaccine and are taking up their second. So the idea that this is just a minority of younger people who haven't is completely untrue, and we should always start from that basis.
That's right. Thanks very much, everybody. Thank you. Thank you.